Hello and welcome, everyone. I am Rachel, Community Manager here at Alloy Women's Health. We are a digital health platform bringing science-backed, evidence-based menopause hormonal solutions direct to your door. Today, I'm thrilled to welcome back to the platform Dr. Judith Joseph, a board-certified psychiatrist, researcher, and award-winning content creator who specializes in mental health and trauma. Dr. Joseph holds academic and leadership roles at Columbia University and NYU and leads clinical research at Manhattan Behavioral Medicine in New York City. She has been recognized with a Congressional Proclamation Award, named a 2024 NAACP Mental Health Champion, and taught workplace mental health to the Executive Office of the President. She's a sought-after speaker and media expert featured in Oprah Daly's Menopause special and the Magic of Menopause Masterclass with Halle Berry. Dr. Joseph's upcoming book, High Functioning, is based on her groundbreaking research on high-functioning depression. With nearly 1 million followers, she's passionate about using media to make mental health education accessible. Before we jump into our conversation, I want to invite you to drop your questions for Dr. Joseph into the Q&A. I will circle back to those and also invite you to take advantage of today's code, which you saw on the banner just before we started over on our website, myalloy.com. Welcome, Dr. Joseph. It's wonderful to see you. Launching into things, we hear a lot about estrogen's role in hot flashes or bone health, but what is its relationship to mood, memory, overall emotional resilience?
Well, thank you for having me. It's great to see you again. It's
Okay.
our 1-year anniversary of
It
doing
is.
a webinar.
I love
So,
it. I love
so if
it.
you
We'll
want
make a
more
big,
after this.
yes, wonderful.
And it's fitting because April is National Stress Month and we are all feeling it right now because, we just finished the first quarter of the year. So we may be experiencing that first quarter burnout, right?
Yeah.
Especially if we're also parents and career women or have a lot of responsibilities taking care of our parents and so forth. So yes, estrogen impacts every part of the body, and including the brain and including your behavior. And I try to educate my audience about something called the ties of mental health and menopause. The T is thinking. So this is the way that your brain functions in terms of memory, planning, making decisions, that's impacted. And so that's what we call thinking, or if you want to be fancy, cognitive. And then the I is identity. And this is probably the most common thing I get asked is, I don't feel like myself anymore. And that's because there are changes that are happening in your body, in your brain, with the way that you look, in terms of the way that you move, where you're just like, well, I just don't know who I am anymore. I feel like I can't do the things I used to, or I don't feel the way I used to. And that's the identity issue. The E is emotional. And that includes symptoms of feeling sad, what you consider symptoms of depression, not a true major depressive disorder, but they're symptoms of depression, or anxiety, right? Nervousness, worrying excessively. And then the S is sleep, which tends to be the first thing that I see and people experience as they enter perimenopause. They just can't get good sleep, or they wake up in the middle of the night and they're like, I'm not stressed, what's happening? But your sleep
Right.
architecture really changes and responds differently to hormonal fluctuations. So when you think of the TIES, the ties of mental health and menopause, that's important, not just to have a label, but also to just know what's happening. Because if you don't know that these are symptoms tied to hormonal fluctuations, then you can spend a lot of energy, effort, and money
Yeah.
chasing solutions that have nothing to do with what's happening in your body, right? So you're not even getting the relief that you deserve in time because you're so busy chasing other things, or your doctors are
Right.
busy. And it's important for patients to know the ties because, as you all probably know, the doctors don't know. A lot of healthcare professionals are not taught about menopause and perimenopause, let alone the mental health stuff, right?
Right.
Um, in training. And so it really is up to us as patients to advocate for ourselves and to know what the common mental health symptoms are so we get the appropriate support and treatment. And we don't
Thank
get the wrong treatment, which can have
Yes.
additional side effects and additional problems that we don't need right now, you know?
Yes, yes. Thank you for that, Dr. Joseph. You kind of walked us through in about 30 seconds, sort of the entirety of this conversation, which is sort of how to recognize that perhaps perimenopause symptoms have started for you. It may be that your first symptom, and I think many women report this after the fact, meaning well into perimenopause, maybe they're menopausal, and they sort of recognize then, oh, my first symptom was a mental health, I hate to use the word issue. I don't know if that's the correct way to phrase it, but an episode,
Umbrella.
an
I like to under
umbrella.
the
Okay.
umbrella. It sounds
Under the
more
umbrella. Okay, so sleep would be a thing, anxiety would be a thing, depression would be a thing. What else might you look for if a patient comes to you after the age of 37, let's say, I'm just throwing that out there, and says, I don't feel like myself? Because I think for so many women, as you point out so well, we start like looking here, looking there, going to this expert, that expert. We need help helping experts home in on perimenopause.
Yeah, that's a great question. And I was just asked this recently at a talk that I gave because one of the women raised her hand and she was like, there's so much going on in my life and I have a history of depression and I don't know what's what. How do I know what's what? Well, remember that the mind body connection is real. So if you're having fluctuations in your hormones, then you're probably going to see things in your body happening. So um, if you're having, let's say, recent sleep problems, what else is happening in your body? You know, this
Mhm.
is where it becomes a little bit fun. You become this like kind of detective of your own health and you start
Yeah,
taking your little notes, like, you look at your skin and, oh, is my skin dry? Am I having vaginal dryness? Am I having changes in urinary frequency? Am I having changes in my hair? Am I achy in some places? Am I having GI upset? There's so many physical symptoms
yeah,
that could be happening due to the fluctuations of hormones in perimenopause and menopause. So usually it's not isolated. It can be, but usually there are other things happening too. So in addition to having poor sleep, you may be having changes in other organs. And that's why it's important to, be the expert in your own journey.
yeah,
And I educate women using the 3 Ps.
yeah.
So
I love the 3 Ps. Tell us those.
thank you. It's
Yeah,
so easy to remember.
yeah.
And so, if you are having, something that is changing your body's menstrual cycle, right? And you're also having these emotional type of experiences, then look at your period changes because major depressive disorder does not have period changes as a part of its diagnostic criteria.
Mm.
So if you're noticing changes in your flow, like you're having heavy bleeding, and then also like just irregular menstruation that is atypical for you or not typical for you, and you're having these changes with sleep or mood or the other ties that I mentioned, then you're likely experiencing the hormonal fluctuations. The problem is a lot of therapists and psychiatrists will not ask you about your period, right? They won't. So they won't tie the two together. And that's why you're using the T.I.E.S method to tie all of those symptoms together, right? So that's the first P. The second P is physical changes. Again, because Western medicine is so siloed, a lot of therapists or, psychiatrists won't ask you about physical changes. They just won't, right? They'll go through the checklist and be like, let's just make sure this is not bipolar, this is not psychosis, or this is not this. But they're not asking you about the changes happening in your skin, your joints, your hair, your GI, all these things that happen, you know, in midlife. They're not going to
Right.
ask about that. So if you're having these, you know, thinking or emotional or sleep changes, and you're having these bodily changes as well that you don't recognize, then you should be thinking, this could be perimenopause or menopause, right? Because hormone doesn't just stay to one part of the body.
Right.
They spread, they go into the bloodstream, so they impact all the
Right.
cells.
Hmm.
And then the third P is past history. So people who have a past history of trauma are going to have, more worsened, symptoms in menopause. People who have previous depressions. We need to think about having like, a recurrence of these depressions in midlife when you're vulnerable. Same thing for postpartum.
Right.
Um, you know, so the past is really important. And also, like, it's important to think about your past family history. When did
Mm.
it's not always, perfectly correlated, but when did your mother or people, what other women in your family go through these changes? Was it around the same time as you? So the past is important to put into play. So when you have this information, then you know what to do. And it helps me. Like, if a lot of my patients who have a history of postpartum depression, we start planning for their perimenopause and menopause if they're getting into their like 40s, right? Because I'm like, I know you have a history of having hormonal vulnerabilities for your mood. So I'm going to start preparing you. Like, you're going to have to start, doing things differently in life just to be prepared. It's always better to be prepared. Always better.
Can you expand on that a bit more? Because I think we're seeing younger women now sort of entering the chat, as it were, right? As a result of these conversations that have been happening for the last several years, focused on perimenopause and menopause. And preparation is everything. If we know from our mothers and our grandmothers, right, the experiences they've had during this season of life were so impactful because they didn't have open discussion. They didn't have solutions necessarily being spoken about freely and so on. So dig into that a little bit more for us. Sort of what do you say to younger women? How do you get them prepared? How can we help them get prepared?
Well, in my book, I talk about a psychological principle called affect labeling. And I use this analogy that if you were in a dark room and someone made it pitch black and you didn't know what was happening, you couldn't see what was happening, and you heard a big thud, you'd freak out, right? You'd start swinging. Some of us start swinging, some of us run to the door. Others of us would just hide in a corner. But if you
Yeah.
turn the light on and you see, oh, like that was just like, a vase that broke. There wasn't someone in here trying to get me, then you're like relaxed again. And it's the same for when you know what's happening to you. When you know what it is, there's a calm that goes along with that. It is therapeutic in itself. It's not granola-y, it's not corny. It is how we think. Human beings, we can't handle uncertainty. It literally drives us crazy. We start imagining the worst case scenario. That's why a lot of people will be like, oh my gosh, I have all these odd symptoms that don't mean anything. There's no one thing on Dr. Google to explain it. So they're like, I have cancer,
Right. Right.
because that's how we operate. Our brains need to feel safe. Our brains need to know what's happening. So that's why we need to know what to expect and we need to know how to prepare because that is therapeutic in itself. Sometimes that intervention is better than what any therapist can do for you,
Right.
right? Especially when you're in a vulnerable state, and you have a lot going on. So being prepared, means thinking about things not when they happen, but thinking about them before they happen. If I were to tell you, Rachel, like you should start saving for your retirement in your 50s, you'd be like, you have an MBA? Where'd you get your MBA from? You'd be questioning me, right?
Right.
But but if I told you to start saving for your retirement in your 20s, you'd be like, okay, that makes sense,
Mhm.
because that gives me time and preparation so that
Mhm.
I'm not hit with any surprises. And if I am hit with surprises, I have a nest egg, right? I have
Mhm.
something to hold on to. It's the same when you're younger, and you're in your 20s and you're having your smoothies and your salads and your rabbit food and you're on your like elliptical, that doesn't cut it in your 40s. I know,
Oh, it
right?
doesn't.
It doesn't. You
No.
start noticing that midsection fat and you're like, where did that come from? Right?
Mhm.
And then you start questioning, maybe there's something I'm doing wrong. Like,
Oh.
but it's not you, right? And that's why it's important to know these things are coming. If you know that estrogen changes in your brain can make it harder to clear some of the plaques that, cause thinking to be an issue, if you know that's happening and that's starting to happen, in midlife, then you're going to be more compassionate with yourself in terms of your scheduling. You're not going to schedule yourself the way you did in your 20s where you had like 10 things going on. You'd probably prioritize what's the most important and be like, I'm going to focus on these one or two things today. The other stuff, it's not as pressing. So I could put that on the back burner or I'll delegate responsibilities, right? So it's not to say that you're not as smart as you used to be. No, you're thinking differently and you have different vulnerabilities. So you have to do things differently, right?
Mm.
If you know that that these changes can cause problems with your joints, then and also osteoporosis later in life, you're not going to be eating these, this rabbit food in your 30s and 40s. You're going to be getting more protein because you
Right.
know that you're going to experience muscle loss and you need that bone strength. So you're going to be getting calcium. Just do things differently. But if no one tells you what
Yeah.
to expect, you don't feel prepared. And then you're in your, you know, midlife and you're just like, why didn't anyone tell me? And now you're just like stressed out. And it's never too late. It's never too late. You see these videos of these like 75-year-old women lifting weights, and you're like,
Yeah.
it's never too late. And they show the transition. Those are like my
Yeah.
favorite videos.
Yeah.
And it's like they told me I was too
Incredible.
old to lift weights, and then you're like, and the woman's like jacked in better shape than like
I know.
we are. And I'm
I'm
like, man, I
jealous.
gotta start
I
lifting
know.
weights. All of these things are important.
Yeah.
And in terms of your emotional well-being, cutting out the toxic
Mm.
habits is so important. Again, have going to the happy hour in your 20s. You may not be able to do that as you start to get into your 40s and your 50s because your brain just operates differently. Your liver metabolism is different. But if no one tells you this, then you're treating your sleeping problems with alcohol and it's
Right.
not getting better, everything's getting worse. So
Right.
cutting out the alcohol use as much as you can and things like smoking cigarettes, all of that plays a role. And then making sure that you're actively addressing your stress, which is a challenge, right? We're in National Stress Month. I have a small kid. I have elderly parents. I have a team to take care of. I teach at NYU. I get it. But for me, if I don't take the time to actually have breaks, intentional breaks in between my sessions or my appearances, then I'm going to be run ragged. So I have to sometimes tell myself, I keep a mirror on my desk and I say, you look tired. Like you need to
Mm.
slow down. I literally will talk to myself and then
Mhm.
I'll sit and I'll eat my salad or whatever, my protein, and I'll just eat it mindfully and be like, I'm not going to check a screen. I'm not going to, answer a call or return text message. I'm going to just sit here and eat and hydrate. It's these small things that you can do to acknowledge that you can't be doing things the way that you used to be doing them. That is a one-way ticket to burnout, exhaustion, and depression.
That's so helpful, Dr. Joseph. Thank you. Is there anything else that comes top of mind that you might say to all of us here? This is critical that you sort of give attention to this.
Yes, like in mental health right now, no one's really telling us to prepare for, you know, preventing a breakdown. There's so much information about cancer, right? Like prevent a cancer, prevent an osteoporosis with hormones. Prevent heart disease by checking certain markers and eating well and so forth. But no one tells you how do you prevent a mental health breakdown, right? And that's the topic of my work in high functioning depression because a lot of us are just like pushing through. We're doing all these things,
Yeah.
but we're waiting until people break down and check that box at the bottom to do something about it. So start preventing it now. If you're starting to feel these signs of emotional wear and tear, and you're dealing with the added vulnerabilities that come with hormonal fluctuations, you may need support from all directions.
Yeah.
You may need to support from the doctor who prescribes your hormones, but you may also need a therapy to support you. And then the social factors in your life need to probably change. And that's why I say understand the science of your happiness. I usually use something called the biopsychosocial model so that everyone knows what they need personally. Yes, we're all humans, but we all have a unique biopsychosocial. And it's a tool that's taught to medical students, but I democratize that in my book because I want people to understand the science of your happiness. There's only
Mm.
one Rachel. There will only ever be one Rachel. in the history of the universe and in the future of the universe, just one. So imagine how like you are here for a reason. So
Mhm.
understand who you are. And if you don't understand the science of what's making you unhappy, right? Then how can you understand the science of what can make you happy? So so for a typical, person probably who's listening to this biologically, you know, what's your past history? What's your past medical history? You may have a different medical history than mine. I have low thyroid. You may have something else that could challenge your happiness.
Mm.
I'm in perimenopause, but someone listening to this may be, early in the process or later in the process or postmenopausal. Understand how that affects you biologically. What's your family history, right? And then psychologically, what's your history in terms of traumas? Personally, I came to this country when I was very small, had very little. So I have a whole lot of scarcity trauma to unpack, but someone else's, may have a different type of trauma, and or they may have different resiliency factors, different attachment styles. And then socially, what's happening around you in your environment. What type of foods are you eating? Are you eating foods that are high in processed in sugars that cause inflammation? Are you engaging in activities like drinking excessively or smoking that's impacting you? What's the quality of your relationships? Because that's like the number one predictor of longevity is the quality of your relationship. So, are you in a toxic job? Are you partnering with someone who's unhealthy? Do you have a lot of stress in your personal relationships? All of those, the biopsychosocial, all of those can either add to your happiness or pull
Right,
from your happiness.
right,
And
right.
then you can use tools effectively because many of us, we just read a book or we see a talk and we're like, I'm going to use that. And then it's not working for us. And then we feel discouraged. Like, what am I doing wrong? It's because you didn't understand the science of your happiness. So you're using
Mhm.
tools that may not even be meant for you, right? If you're going through, the menopause transition and your hormones are going up and down, you could do all of the positive self-talk that you want and positive affirmations in the mirror, but that's not helping you,
Right.
right? That doesn't address what's happening biologically, which is probably what's the most the area where you need to put the most effort at that point in time.
Mm.
Other people who are listening to this, maybe their hormones are okay and they've figured out the right, regimen for them, but socially, their social life is a bit chaotic. Maybe they've experienced grief recently and they don't have the
Right.
supports, right? And they're feeling very lonely. So for that person, I'd be working with them to get a peer support group in place or get them connected to an organization. What if someone's biologically they're stable with their hormones, socially they have a good social rhythm, routine, and support, but psychologically maybe they have past trauma that's not process. So they're constantly in fight or flight, and that's what we need to focus on in that moment is getting their stress levels down because of their past trauma, right? Everyone's so different. So understand the areas of your life that are distracting from your happiness so that you can support your happiness better.
Amazing. Thank you, Dr. Joseph. I love speaking to you because you really do like envelop all of it. It's really this like holistic look in and look out. And I so appreciate that. Thank you. I do want to kind of weave a thread now between your book, High Functioning, and the inner lives of midlife women navigating menopause specifically, because there is a powerful overlap there. So your book, High Functioning, congratulations, it comes out on the 8th, everyone. Your book explores the silent struggles of people who look fine on the outside, but are unraveling in many ways underneath. And that describes so many midlife women juggling work, caregiving, hormonal shifts, and still trying to keep it all together. How do you see high functioning depression showing up uniquely in this population that we're speaking to, and what's often missed?
Well, this fact often surprises me, but then doesn't surprise me, right? Like women are twice as likely to have depression and anxiety than men, right? Shocking stat, but not surprising. You know,
Mhm.
we just deal with so much. Biologically, we are at risk because of the hormonal vulnerabilities throughout life, starting from puberty, where some of us have mood and emotional and anxiety issues around our period, and then postpartum, and then the menopause transition, right? Biologically, we're more at risk. Psychologically, women tend to be in relationships where they may be, not treated that well and
Right.
have high rates of trauma. And then socially, where we have to work twice as hard and we get paid less. There's a lot going on socially for us in the world. There are many challenges for women. But on top of that, there's this added societal pressure to appear youthful, to appear attractive, to appear happy and perfect, while doing way more than
Mm.
most men of our same age are asked to do.
Mm.
So, in fact, we have the more pressure to prepare high functioning when we're actually struggling. And many of us, we just push through and we don't think about it, we don't process it because we are the rock, we are the caregivers. And in my study on high functioning depression, it was the first peer reviewed study in high functioning depression to ever be published in the world. You can find it on PubMed. We found that caregivers had a higher rate of something called anhedonia, which is a lack of interest and pleasure in things. So, for example, you know, you may be like listening to your favorite song, and usually you're like moving or jamming or you're feeling good about it, but lately it's like, doesn't light you up. Or you're eating your favorite food. Let's say you love sushi and you're eating it, and your favorite roll, it just doesn't give you the same zing. Even if you know it tastes the same, you're just not into it. Or,
Mhm.
it's difficult to enjoy intimacy with your partner, whereas before it wasn't. These are the simple joys in life. And many people, especially people who are high functioning with depression, they lose that joy for life. It's called anhedonia. And it's not a term that I thought of. It's been around for since the 1800s. It's in most of the psychiatric rating scales, but the majority of the public have never heard of it. They always say, "Anha what?"
Mhm.
They think it sounds like someone's like exotic name. No, it's
Yeah.
actually, it means a lack of joy. And it's a sneaky symptom because it's not glaring. I always say depression is like twin sisters, right? But they're not identical twins. The depressed, the one who looks depressed gets more attention, so that's the sadness.
Yeah.
But the anhedonic one, who's just blah meh,
Mm.
doesn't get any attention, and in fact gets missed, gets
Hmm.
ignored. And
Mhm.
so if you go to your doctor and you're having symptoms of depression, but you're not meeting criteria for no longer functioning, they're going to say, well, why are you here? Like, we only treat people when they break down. So, like, when you do break down, come back, then we can treat you. But what they're missing is anhedonia. Very rarely they'll ask you, like, are you enjoying life? Are you
Yeah.
getting most out of life? And why? Because a lot of doctors are overwhelmed themselves. They're probably high functioning too, right?
Mhm.
And they just have a quick minute to see you and then out. So the doctors aren't sitting down asking you about joy in your life. They're like, why would I ask about that? That's not a
Right.
problem. We're fixers.
Right.
But
Right.
it is a problem because if you're not getting joy out of life, that's the point of being a human being, right? It's important for you, even when you're overwhelmed, even when there are problems in your life, to at least be able to pull some points of joy out of a day. Because joyful people or people who have more happiness have better health outcomes, better financial outcomes, better relationships. Everything's better when you have joy. Not to say that you have to be happy all the time. That's not what I'm saying. But even being able to access some points of joy makes you happier over time. And I always say I have a research lab and then I have a private practice. My private practice patients will come in and say, I just want to be happy, right? But in the research lab, we're all about trying to get you more points of joy. So we're
Hmm.
asking you questions like, when you took a nap, did you feel rested? When you saw a friend, did you feel connected or loved? When you ate your food, did you savor it, right? These are all the points that make someone actually happier. That's how we add it up in research. But in the real world, it's like, I just want to be happy. It's an idea. Happy is an idea, joy is an experience. So if you can reframe, right, instead of I'll be happy when I feel back to my normal self. I'll be happy when my kids get into college. I'll be happy when the research shows if you have that thinking and delay happiness until when, you will still not be happy even when it happens. So try to
Yeah.
get your points of joy in a day, right? You may not get any points today, but tomorrow's another day. You can get 1 point or 2 points. And that's important. That shift is important because it provides more hope. Because if you're just like waiting to be happy when something happens, then sometimes it feels so out of reach that people get hopeless. But if you're like, actually, I can get a point today if I take a walk, or if I get a point today if I call a friend, and I compliment them and I tell them I love them. All of this is all within reach. So we have more access to joy.
Ah, fantastic. Thank you. Thank you. I have one more question to ask you, and then I'm going to turn to questions that came in the Q&A. Again, taking a look into your book, you explore how emotional suffering can hide behind competence. And for midlife women, especially those going through perimenopause and menopause, that suffering can also be hormonally connected. How do you help women sort of untangle what's circumstantial, what's chemical, what might be both, and how do treatments like MHT, antidepressants fit in?
Yeah, that's where you really want to understand your biopsychosocial,
Right.
right?
Going back to that, yeah.
Because two things can be true. You could be vulnerable right now biologically because of your hormonal fluctuations, right? You use 3 Ps to figure that out.
Mhm.
But also a lot could be happening in your social life. And
Mhm.
also for this, social bucket. And also a lot could be happening in your psychological life. You may have a past history of depression where you've needed antidepressants and maybe you need them again. And that's where it's like understanding you, the science of your happiness. So a lot of times I'm sitting in these rooms. I was recently in a room with like 300 women, and they were like literally drawing their biopsychosocials with me, and they were
Mhm.
filling them out. And everyone had a different one. No two biopsychosocials is identical, right? Just like fingerprints, they're just not. Because again, there's only one you.
Mm.
So acknowledge that and honor it. And in my book, I talk about all of those things that some people will need antidepressants when they're going through periods in their lives, but also others may need medications to support their ADHD, right? And other
Right.
people will need medicine to support them because they have bipolar disorder or they have, treatment resistant or like their depression's difficult to treat and it's labeled as treatment resistant. Some people need
Mm.
psychedelics. I do psychedelic research in my lab. Um, Other people will need anxiety support. Everything's dependent on the individual. Um, but, if you're someone who does need that hormonal support, that don't ignore that. Like a lot of times what I see is people trying to delay that part as much as possible and then suffering,
Yes.
unnecessarily and then saying, "Oh my gosh, I wish I had done this sooner. What was I
Right.
thinking?" But it's because they just didn't know. They didn't have the information or they were afraid, right? Don't do it alone. In my book, I talk about the 5 E's to thriving. And I use five because most of us have 5 fingers. So it's a nice imagery, like joy is within reach, right? We just forgot how to access it. So the first is validate what you're going through, acknowledge it. So validation is accepting I am in midlife, my body's going through changes, but I am still me. And that could be so powerful, right? Vent it. So that's expressing it. You could talk about it with a friend, don't do it alone. Talk about it with a healthcare professional. You could pray about it. That's a way of venting. You could write about it in a journal. That could be very powerful for some people. The third is values. People who tap into values that give them meaning and purpose tend to have overall better outcomes, right? So, what are the things that really give you a sense of belonging that you should be here on this earth, right? Is it a cause? Is it a faith? Is it your family? Try to tap into that and figure out what those are. Many of us chase the values that have price tags, not the ones that are priceless, right?
Right.
We want the things, but those things are not things we're going to want on our deathbed. We're not going to be like, I wish I got another purse and shoes. We're going to be like, I
No,
wish I had more time with
no,
our
not at all.
family. That's the
Yeah.
values.
Yeah.
And then the fourth is vitals. Think about how you want to change the way that you treat your body,
Mm.
right? Are you going to be getting more sleep and drinking less caffeine? Are you going to be thinking about keep your room cool because you have hot flashes? Are you going to be thinking about the way that you eat, before bedtime because that can impact the quality of your sleep, right? Within vitals, there's movement, right? Are you going to start lifting weights versus, running on a treadmill?
Mm.
Not to say that's not important because that helps with stress, but may have to shift the way that you treat your body in terms of movement. If you're someone who's sedentary, maybe you do want to start with
Right.
walks. Walks are extremely beneficial. Within vitals, there are things like we talk about diet, but also technology. What's your relationship with technology? Many of us are doom scrolling at night and it's
Mm.
not helping what's happening with us. It's our way of trying to control stress, but we're actually making our brains even more stressed out.
Hmm.
And I talk about other non-traditional vitals in my book. Um, and then, the fifth is vision. This planning joy doesn't just happen, you have to plan it, right? If you're
Right.
lucky, it happens, if you're lucky, you have someone pop in through the door with flowers every day.
Right.
Joy
But
needs to be
unlikely.
planned,
Yeah.
right?
Yeah.
Yes. And so start planning points of joy in the present. So like in between this talk and my next talk, I'm gonna definitely get a nice like matcha. It's like my thing. I love it. And there's a place downstairs that's amazing. But that I'm already planning joy and looking forward to it. But it doesn't have to
Yes.
be like that. It could be a get together. It could be, something else that you celebrate. But plan joy in the present and the future so that you keep moving forward instead of getting stuck in the past. And those are the 5 V's in my book. I don't say do them all at once because that would be too overwhelming. Pick a one or two and try to
Sure.
tap into joy every day.
Fabulous. Thank you. Pivoting to questions. Diagnosed with depression, taking antidepressants, going to therapy, on hormone therapy, only feeling minimal improvement in mental health. I resonate with the term anhedonia. Is it possible this is just my personality?
Well, a lot of times, again, if you, after this talk, you do your biopsychosocial, a lot of times other aspects are not being addressed, right? So, with regards to the antidepressant, is it too low of a dose? Or are you on it for not a long enough period? I see in my practice people being referred to me and they're on these like tiny, tiny doses. And I'm
Hmm.
like, did anyone ever increase it? But it was because they were getting it from either their GYN or their internal medicine doctor, and they weren't as comfortable, you
Sure.
know, increasing the dose, or they've been on the same thing for like years and no one ever changed it because it was what the previous doctor had prescribed, right?
Interesting.
So when people say I'm on an antidepressant, I want to think about how long, which one, how many have you tried? Because there are so many, like what's actually happening with you with that antidepressant, especially if they're having anhedonia, because
Mhm.
anhedonia, that lack of joy, yes, we want to address it with medication, but also we want to look at it from other avenues, like what's happening in your life. How much are you tapping into things that you used to enjoy, or have you just stopped doing them altogether because you say, well, I don't enjoy it, let me not do it. Sometimes in my practice, if people have stopped tapping into something that used to bring them joy, they automatically assume it's because it's not going to bring them joy anymore. So they just
Mm.
abandon it. For example, I once worked with someone who at one point in their lives, they really enjoyed nature, but they don't tap into it anymore. So they assume that, well, I just must not enjoy it anymore. Well, no, you live in a big city. You're very rarely able to go out and hike or camp. So let's challenge it and let's see. I'm going to give you an assignment, start with a plant in your home and then,
Mm.
go for a walk in the park and let me know how you feel after that. And many times they'll say, I just assumed I didn't enjoy it because I hadn't been doing it, but maybe I don't enjoy it because I'm not doing it anymore, right? So
Right,
like
right.
sometimes actually engaging in the behaviors that once brought you joy brings back joy. It's not all about medicine. So that's why it's important to
Mm.
look at the biopsychosocial, right? So that you see the full picture. And this is hopeful because that means you can access joy in multiple avenues, right? Not
Yes.
just one.
Yeah, it's also so important. What you're saying is being intentional about it, which I think
Mhm.
can feel particularly difficult, especially if you're dealing with anhedonia. But it sounds like even just touching base with people in your world, what did I used to like? Or just
Mhm.
writing it down. What did I used to do that made me happy and maybe revisiting it. So that intentionality seems particularly important.
I mean, look, I look at myself when I was going through 2020 and uh, being there for my team and for my family, and it was a lot. I was experiencing anhedonia and high
Mm,
functioning depression, and I had to look back at what did I used to enjoy, and I was like, I don't remember because I've
yeah.
been basically a workaholic all my life, medical school,
Yeah.
residency,
Yeah.
starting a lab. And I forgot, and I'm a psychiatrist. I forgot what I enjoyed. It was
Mm,
only when I started to create content that I remember, wait, when I was little, my siblings and I used to put together plays for the church like every week because my
amazing.
dad's a pastor. And here I am creating skits for the world, right?
Is that where
I
that came from?
Yes, that's where it came from.
Really?
I was not classically trained, so don't think that I'm
Amazing.
an actress or
No,
anything
I
like that.
love that.
But
It's a revisiting of your youth that brought to the fore, and it's opened up a whole world for you and people receiving it. It's amazing.
So yeah, sometimes it takes a bit of reflection. That's where, the second V, venting, right? Writing it in a journal. What did I used to enjoy?
Hmm.
Sometimes it's a past trauma. In my PTSD research, a lot of times people forget the past because they have these traumas that they never process, and the trauma forced your brain to forget it. So people can like forget all huge chunks of their lives. It's like hazy because your brain was saying, let's protect you from that. But then what happens is that you forget everything around that. And so you forget what you used to enjoy. But
Hmm.
know that in that past, you can start to work back and process that trauma and figure out what lit you up before that trauma happened.
Fantastic. Thank you. Another question. Before knowing I was in perimenopause, I was prescribed a benzodiazepine to stay asleep. Now I'm on estradiol, no uterus, so no progesterone, for over 4 months, and I feel so much better in every way, but still can't sleep without the meds. Is there something I can do or take to get off the benzo and help with insomnia, or will sleep eventually normalize with just the estrogen?
That's a great question. Benzodiazepines, I describe them as, I use this analogy. If the anxiety is a hole in the roof, the benzodiazepine is the temporary like plastic
Hmm.
to cover it until we fix it with real wood, right? Or
Okay.
whatever it is people use on roofs. I live in an
Yeah.
apartment, so I have no
Yeah,
idea.
I know. I don't know, shingles and I don't know.
Scaffolding, I don't
Yeah,
know.
that kind of thing.
um, but benzos shouldn't be long term. But they're okay to use short term because they get you that relief that you need. But really, most sleep medicine doctors would try to get you onto a regimen of something called cognitive behavioral therapy for insomnia, if it's true insomnia. And they'll start off with like what is called sleep hygiene first to see if you're even doing the basics. So, are you keeping the room cool? Are you limiting exposure to light after 9 p.m.? Are you eating foods that actually promote sleep, like things like walnuts and bananas and, you know, ripe or sweet cherries and things like that, using chamomile teas, all these like kind of ways to do things without medication first. Are you engaging in tools that specifically help with the worry around sleep, like worry procrastination, other type of like methods that are actually taught in cognitive behavioral therapy for insomnia? Do you have sleep apnea? That's the one that gets missed all the time in midlife because your rate of sleep apnea goes up as you go through the menopause transition. But many people don't get evaluated because they don't look like the typical person with sleep apnea. Usually, when you think of sleep apnea, you think of someone who's a bit more heavy set and they have the airway, their neck is thicker and the tongue is thick. But that's not the case. In midlife, you go through changes in your body that could cause sleep apnea. So that's why you're not getting deep, rich sleep. So there are many factors involved, but the benzodiazepine, it should be only temporarily. And in my practice, I'm not your doctor, so I'm not going to tell you what to do,
Right.
but mostly we try to keep it temporary. And there are other sleep aids that can be used, like trazodone, Remeron, that are not controlled substances. Um, and sometimes even an SSRI can help. I've seen that, but it all depends on you. If you're not going to see your doctor regularly, they may just continue to give you the benzo just because they don't get a chance to try something else.
Hmm.
But there are risks associated with long-term benzodiazepine use. Again, talk about it with your doctor, but there have been links to like to dementia, memory
Hmm.
issues. So that's why people try to stay away from them. And there's a potential for dependence on them.
Interesting.
Um, so, again, there are options for you. If you haven't seen a sleep specialist, that's something to consider. If you haven't done a sleep study, that's another something to consider. Or it could be something else happening. Sleep is related to a whole slew of issues,
Yeah.
not just menopause and not just depression or not just anxiety.
Great, thank you. A couple more questions. I'm very conscious of your time. Will symptoms of brain fog slash mental clarity correct itself in time, or does it remain after menopause?
Well, the research shows that it does correct, but in some people who are at risk for, cognitive issues later in life because of genetics. You
Mm-hmm.
know, for a very small amount of people, you want to be aware of things like dementia, because I don't want to say everyone's going to be resolved, but
Sure.
for the majority, it does get better. And so, but it doesn't mean that it's not taxing and stressful. And so, what I like to implement with my patients is something called organizational skills therapy. It's something I use with my clients who have ADHD.
Mm.
So it's a behavioral therapy that that you can use if you have a therapist who does it, but you're trying to limit the tasks on the brain all at once. So you're not going to task your already vulnerable brain with 100 things. So the
Right.
first thing you're going to do is you're going to prioritize things that really are important. So you're not going to be like multitasking at the wazoo like you used to.
Right.
And you're also going to try and simplify your environment. So things like decluttering, keeping the place tidy so that you can find things easy. So you're not spending 20 minutes getting dressed because all of your outfits that you typically wear in one area of the closet. Doing things like planning. So if you have a big day the next day, let's say you have a trip, you're not going to wait until the morning of and say, I'm going to wake up early and plan. You're going to set everything up over the course of a week, right? So if you know you have to pack for warm and cold weather, because sometimes you do, you're going to
Mm.
start your packing a little bit every day. And then you're going to start leading up to the trip planning that you have your things printed out, you know where you're going to stay. I know it sounds very basic and super 90s. But when you have things that are easy, like you have a little folder, even today we use folders and file systems with people with ADHD, but it's helpful because when you're stressed and you're trying to find things on a phone, and if you can't find it, then you get more stressed and it becomes a vicious
Right.
cycle. So you're just trying to make your life as easy and concrete as possible leading up to this big event. Things like having a launch pad in your home. And that's a place where you put your keys, your wallet, your eyeglasses. These are the things that you're always like, honey, where's my this? And
Right.
honey, where's that? For
Right.
me, it's my earbuds. I'm like,
Yeah.
I have a little launch pad for my earbuds because I've lost so many. I've like
Yeah.
Apple is making a small fortune, right? So I try to keep certain things in the same area. And then my suitcase. Like I bring a suitcase to work every day. Like, and I ask my clients, your book bag or your suitcase, just try to keep it so the things are in the same place every single time, right? These sound like, oh, duh, yeah. But no, if you're not doing these things, you're making your life more difficult than it has to be. And there are certain things that are not within your control, right? You can't
Right.
control your brain, you can't control your aging. But these are things that are actually within your control that you can actually plan to make your life easier. And they're in organizational skills. One thing that I use a lot now that I'm in perimenopause that ADHD clients use is a body double, right? You're sitting with someone who sits with you so that you get your work done. So I'll be
Mm.
like, with one of my coordinators, I'll be like, can you sit with me? We'll do this together. And we get it done because it helps me to stay on
Wow.
task. So you may have to use your partner as a body double, like, hey, I have to do this, these things fill out these forms for the house, but I find myself like wandering. So can you sit with me? To do
Amazing.
it. These are all hacks from ADHD, organizational skills, but they're helpful in other areas of executive functioning vulnerabilities like perimenopause and menopause.
Fantastic. Thank you. Um, this question had come into me and I want to make sure I get to it because there are a lot of people who may act as body doubles in their person's life, in a friend's life, in a partner's life. This person contacted me and asked, how do I support my partner who's struggling? She's suddenly miserable, angry, sad, short-tempered, and has no motivation for anything we used to enjoy together. She's also adamantly against drugs of any kind, MHT, antidepressants, etc. This is a lot of things that I'm sure you hear a lot in our demographic. I certainly do anecdotally, either, oh, I don't really want to take that, or I just don't feel like myself, like we've talked about. How do you support another? Can you support another?
That's a great question. I get asked that all the time in mental health. I
Yeah.
mean, I work with people who are caregivers for people with dementia, caregivers for people with schizophrenia or severe mental health issues or substance
Mhm.
use. And it's always going to be the same answer and it's not satisfying, right?
Okay.
You have to take care of yourself.
Mm.
You have to take care of yourself. Again, you can't control other people. And I think it can be so discouraging, but also so freeing, you know, like my friend Mel Robbins says, let them.
Yes, yes, yes,
Now, you can't
yes,
just let them if they're going through a crisis, right? If they're
sure.
really in, or if they're suicidal or anything like that, you can't just let them. You have to get people involved. But, or if they're using substances to the point where it's actually damaging their body and they could, it's really like just can destroy them. That's different. But you cannot force people to do anything. You're never going to force them to take their medicine. I have elderly Caribbean parents, and my father swears by his herbs. Well, the herb will help me. Not THC, but like his like
No.
medicinal like sorrels and his things from
Yeah.
the Caribbean. And I'm like, Daddy, you got to take your hypertension medicine. That
Mm,
sorrel is not going to bring it down. And it's, two things can be true. I tell him you can take your sorrel and your like Caribbean herbs and the medicine.
right.
But for this individual, I think what you can do is first take care of yourself. Usually, when you have these situations, you need support. So you can join a support group for caregivers. It doesn't have to be specific to menopause. It could be a caregiver group for mental health,
Mm,
right? Um, and, and you can learn about menopause because one of the greatest ways to show someone love is to be curious about what they're going through. So you can, just be sitting with that person and reading a book, and that may actually in like a not so confrontational way cause them to be like, oh, what are you reading? Like, oh, I'm reading Dr. Malone's book, on
yeah,
menopause, and it's so
yeah.
interesting. And then they're like, oh, well, what's interesting about it? And that creates like a kind of a conversation. Or you could put on a movie,
Mm,
about menopause, or a documentary, and just be like, oh, I just found this interesting. So these are all like creative avenues to get this
yeah.
person to think differently. That's not so confrontational, because we never listen to our partner.
Hmm.
They could be 150% right, but
So
we don't listen to them. We're like, what do you know? It's
that,
too close to home. So,
right.
you may want to do, expose them to new information, a different way of thinking, a different perspective in a creative way. So it's
Hmm.
not so direct, but always take care of yourself first, and
Thank
don't
you.
do it alone.
Thank you. I'm going to throw two more questions in quickly. This one just came in, and it's interesting because I think I know what you might say, but I'm just curious. So she says, what is something I can do to start balancing my hormones? Can you speak to that a bit? It's a big question.
Yeah.
So
There's a
there.
lot of information out there about like, you know, balancing and supplements and all this stuff. And, I would just urge you to read. That's the best way to balance anything in life.
Mm,
Taxes, financial issues, family issues, read from reputable sources,
get
right?
educated.
Get
Hmm.
educated, because you're going to get so much information that is not accurate
Hmm.
thrown at you, including, products that claim to do a lot of things that they don't. So the best thing you can do is to read about it. What is actually happening. Or if you're not someone who reads because you just think differently, you don't like to read, listen. There are wonderful audiobooks, podcasts from reputable sources, movies, documentaries, all great ways to learn about what really is happening in your body and what actually can be done for hormonal changes. So that's where I would start for anything. If I have a health issue, I read about it, or I try to get as much reputable information as possible so I am informed. So I would urge you to do the same.
Thank you, Dr. Joseph. Finally, um, I have spoken with you before. I've watched and listened to you speak with others. And my takeaway often, as it pertains to perimenopause and menopause, is that perimenopause in particular is this time to kind of revisit, reset, renew, re-engage, um, kind of self-assess in a way we might not have before. Throughout this conversation, you've talked and shared tons of suggestions for sort of how to self-care. But I'd love it if you would just kind of like home in and share one more time kind of what a realistic day would how we would incorporate self-care, joy, happiness today. How can we start today? You're going to get a matcha after this on your way to your next conversation. What is something each of us can look to today?
Well, use the 5 V's. First of all, look at your hand and say to yourself, joy is within reach. Someone put a question there about joy and not being, there are so many ways to tap into joy using the 5 V's. The first is validation, acknowledge how you feel. The reason that this is actually joyful is because when we acknowledge and accept how we feel, that decreases uncertainty in the brain. And when we do research and we add up like stress and anxiety, it's a part of joy. It's one of the points of measuring depression. So by decreasing that uncertainty, you're actually getting a point. All right, that's validation. Venting, expressing how you feel. Venting is a scientific term that means you're literally releasing pressure in air. So, that could be after this talk saying, I felt really curious, right? That is actually improving your joy. Values, what is your value? Maybe because you're on this talk today because you value knowledge, right? And so maybe that was something that made you feel accomplished because you took the time to learn something about your health, right? But for someone else, a value could be your faith or your family. So maybe you're going to go after this and pray, or maybe you'll go and do something with a loved one, right? And then the fourth is vitals. What are you going to do to support your body and brain today? Maybe you're going to go for a walk today, or maybe you're going to dance, right? Maybe you're going to decide to go to bed half an hour early to get restorative sleep. Whatever it is that you do to support your vitals, that's joy.
Mm.
And the fifth is vision, planning for the future. I'm going to get my matcha. Maybe after this, you're going to do something else kind for yourself, and thank yourself for being curious and for giving yourself the gift of knowledge today. But whatever it is, plan it. Everyone has access to those things, right? You may need to reframe your idea because you think joy is equivalent to this idea of happy, but joy are these human sensations that we often take for granted. Being present and intentional about tapping into those things. That is how you increase joy. And if you want to do a biopsychosocial, someone else wrote that in the chat.
Yes, I was
When you
just
when you purchase my book, you get access to all of these courses if you purchase it before the 8th. And I teach you how to do your own biopsychosocial. I have an exclusive interview with Mel Robbins. We both sat down in our homes 2 weeks ago, and had to talk about joy and happiness and stuff.
Mhm.
You have that, and then there are other affirmations. I have a playlist of positive high functioning A affirmations from all of these thought leaders who have overcome struggles in their life. There's tons of tools and bonuses on there. Um, but yeah, definitely get the book,
Please get
and
the
tap
book
into
too.
yes.
And you can get it, you can order it now.
Mhm.
It comes out on the 8th. We are going to be sharing several of Dr. Joseph's books with several of you here on this call. Dr. Joseph, I love speaking with you. You're so delightful, so informative, so helpful. Thank you so much for this time. It is our anniversary. I will look forward to the next, and I will, look for Dr. Joseph. For anyone who you mentioned several places we can find you, but you want to just let us know your
Yeah.
website, your Instagram, that might be here in the chat, but just in case.
Yes, Dr. Judith Joseph. I'm on all the socials. I just hit over 1 million followers recently, so I'm like, wow. Never did I think doing something that was, a hobby or just brought me joy would actually help others. So joy is contagious. Once you
Yeah,
start focusing on your joy, you're gonna see people are gonna be like, "There's something different about you. You're doing something different. You did something with your
yeah,
hair." You're like,
yeah,
"No, I'm just joyful."
yeah.
It is contagious in the same way that unhappiness can be. So invest in your joy because it helps you and your community. drjudithjoseph.com. That's where when you buy my book, you can enter a code from when you get the receipt to get the pre-order bonuses. So if you do
Great.
that before the 8th, you get access to all of those. And you can also just go to a bookstore, all the major ones, or Amazon. but definitely follow me on all the socials, Dr. Judith Joseph.
I just want to quickly, before I let you go, there's so many thank yous here that have come into the Q&A, and I thank you for your questions and for commenting. And Dr. Joseph is just an all-time personal favorite, and I'm so glad that that so many got so much out of this. So thank you again, and we'll be in touch. We'll see you soon.
Thank you
everybody.
for being so joyful, Rachel. It's always a
Thank
pleasure
you.
to speak with you.